Workplace violence, stress, and burnout prevention. Workplace violence. Violence is the second cause of injury and death at workplace. Weekly, 20 workers are murdered and 18,000 are injured. Healthcare workers are at risk for non-fatal results. What are some risk factors? Contact with the public, working with residents with cognition issues, which we have just about everybody here, work late at night, and a number of unlocked entrances. People at risk for violence, cognitively impaired, which many of the residents are, being under stress, having an uncaring attitude, unrealistic expectations about themselves. I should be able to take care of 15 patients at once and do everyone perfectly. Overly critical of themselves. I'm not doing well. I don't do things good enough. I'm worthless. Need to dominate. Those kind of people want to control everything. I want you to do this way and that this way. And a lack of time to relax. Workplace violence. People at risk for violence. Experienced or witnessed violence as a child. Substance abusers. Inexperience. Sometimes you're doing something, you don't know what you do, and you get stressed out because you don't know what to do. Then you're more apt to commit an act of violence. Financial dependency. You feel trapped with the job. You have to have it, and you're angry. Isolated, blaming the victim. You say, she hit me. She deserved to be hit back. And patterns of control. The 5 R's to use in a catastrophic event, if someone is very upset, is to remain calm, respond to what they are saying and feeling. I see that you're angry. I hope you will feel better soon as time goes by. Things will get better. Then reassuring them. Removing yourself from the situation if it just gets out of hand, as long as the person will be safe if you do leave, and return after a little bit of time has passed and hopefully they've calmed down. Documentation of workplace violence. We would do an incident report, obviously tell your supervisor, and if things got really out of hand, we would call the police and assist a staff member if it's safe to do so. Prevention of workplace violence. Communication between the employer and employees. Report problems to co-workers and or to your supervisor or administrator. If you see someone seems really stressed out, you want to pass it on. Okay. My objectives here are for you to identify signs and symptoms of stress and burnout. Describe the impact of burnout on persons and co-workers. Evaluate co-workers for stress levels and suggestions to manage personal and stresses at work. Definition of stress is a state of tension which is created when a person responds to the demands of pressures that come from outside as well as inside. Statistics. Monday morning, people have the most heart attacks. 2/3 of MD office visits result from stress. Stress associates with killer diseases such as cancer and heart disease. Long-term research has shown stress contributes to ulcers, cardiovascular disease, substance abuse, hypertension, immune system disorders, and job-related injuries. Effects of stress. Stress is assessed on 3 levels: environmental, psychological, and biological. External factors affecting stress are people who are susceptible to good and bad stress depending on the environmental factors. Signs and symptoms of stress. Physically, you may have an upset stomach, diarrhea. Psychologically, you may be very defensive, irritable, having lots of conflicts in your life, and other things as well. Treatment of stress. You need to abandon unrealistic goals. You can't clean up 15 patients in one morning and do everybody perfectly. Give up unrealistic expectation for work tasks. Leave your job. Perhaps the job isn't a good fit for you and you need to leave. You can't run around all day being stressed out because of various issues you have with your job. Use your energy wisely. Don't change everything in your life all at once. Communicate effectively. Seek feedback and develop a support network, like lots of friends. Burnout. Unresolved stress. Burnout. State of exhaustion. Physical, mental, and emotional exhaustion. You can become negative, self-concept attitude, work and life and people problems you'd be negative about. And you would exhibit signs of physical depletion, chronic fatigue, feeling helpless, and feeling hopeless. Signs and symptoms of burnout: high absenteeism, excessive use of sick leave, late starts, performance issues, interpersonal conflict in the workplace, emotional outbursts displayed of anger, irritability, etc., workers' compensation claims, accidents, and increasing reliances on substance. The little cartoon says, I called the meeting to discuss absenteeism. Treatment for burnout: physical management. Try taking deep breaths. Have good posture that helps your circulation and reduces pain. Rest helps your body to regenerate. Relaxation is good for you. It just clears your mind of all your problems. Proper nutrition and exercise. Mental health management. Take responsibility for your thoughts and your attitudes. You're stressed. You need to think about why and decide how you can change things so you're not going to be so stressed. And be creatively selfish. That means you nurture yourself.